Hi, I'm Dr. Richard Downs with Sleep Balance Academy. I want to introduce you to Sleep Balance Academy. Let me show you my screen. One of the things you'll first notice when you go into Sleep Balance Academy is it is an unusual site in that it's inexpensive to get training for professionals, but also it breaks the norms for centralized medicine. Many of you have had roadblocks before you from insurance companies, from boards of medicine and dentistry, um, actually physicians, and even insurance companies who don't want you to put a patient into even treatment, but not just treatment, but also getting any testing for sleep apnea. Um, we believe that you must work with your local doctors and PCPs to have an effective sleep practice. We agree with that, but we also believe that you don't need to have to put up with roadblocks to success. And so you're under the misconception that you must build your sleep practice slowly and work with referrals from MDs. You believe you cannot order a home sleep study without the prescription from an MD. You think you cannot titrate your appliances, your oral sleep appliances, with an HST without authorization from an MD or an insurance company. And you also think that advertising for sleep patients doesn't work. We're here to tell you that that's not true. We are taking a whole new approach. And we believe that with Sleep Balance Academy, we can train you to get these tests. As a matter of fact, for instance, a home sleep study, we have a site for that in which a patient can order their own. It's called HomeSleepStudy.com, online HomeSleepStudy.com. And in here, a patient can buy their own sleep test. Now, there is no law against a patient buying their own sleep test. There's no insurance basis to this site, and it's very inexpensive. As a matter of fact, we go through here on why the benefits of this site should be used. As a matter of fact, you can have a patient go to the computer, sit down in your office, help them with their order, and they order it themselves. It doesn't matter whether you've been prohibited in your state from ordering sleep tests by a board or an insurance company has prohibited it because they won't pay for it. The patient can order it themselves. And because it's so inexpensive, most of them pay less than they would if they were submitting to insurance and paying their deductible. Because generally, when that's done, the cost of these tests is quite high. As you can see here, the home sleep test is $275, and we have a number of different sleep studies. We have the Alice at Night 1, we have an Aries, and we have Medibite Junior and Medibite. So we have four different types of sleep studies, and that's growing. And when the patient orders this, they get not only the equipment sent to them in the mail, but when they send it back, a qualified sleep MD who is specialized in sleep medicine will do the diagnosis, the letter of medical necessity, and the prescription that allow you to get the patient treated. So we believe that this is the way to go. And these misconceptions about how you need to get trained and what you can do with your patients, we're going to address that with our program in Sleep Balance Academy. So these are the things that we do. There's much, much more, but and you can go into this when we go, if you want to talk to us by phone, if you want a consultation, we can go over this with you. But we would encourage you to join, and I thank you very much for listening.